We are actually, with NHS Test and Trace, carrying out surveys of reported compliance with self-isolation for people who have tested positive, but the results aren't published yet. But we have a clear set of parameters, and the funding has been allocated to councils to assist with discretionary grants, and they are local decisions. And I've often heard it said that decisions should be local, but I'd ask the Honourable Lady to wait until the Right Honourable Friend, the Chancellor, reports during the budget next week for what additional support we will be giving.
We now cross the Pennines to Imran Hassan. Imran.
Thank you, Mr. Speaker. Last November, I wrote to the Health Secretary to raise a number of serious concerns that have been raised with me by many of my constituents who were unable to claim the self-isolation support payment because of failings with the privately run test and trace system. 3 months later, I have still not had a response, Mr. Speaker. We all know how keen the Health Secretary is to avoid scrutiny for the contracts that his department have issued, but he cannot bury his head in the sand and pretend that these problems do not exist. So can I get an assurance from the Minister that I will get a response and that the problems I've raised will be addressed?
Thank you, Mr. Speaker. The Health Secretary has assured me he has seen your letter, and it's important that people do understand that they need to self-isolate and they're given the right assistance. And this is why the discretionary payments have been made to councils in order that we can make those decisions locally to support people.
Let's head up to Bolton with Yasmin Qureshi. Yasmin. I think. Right. We will go to Shadow Minister Justin Mabbott.
Thank you, Mr. Speaker. The government's roadmap yesterday says, and I quote, "While self-isolation is critically important to halting the spread of the disease, it is never easy for those affected." We agree with that. We have been making that point for months, along with most of the experts advising the government, which is why creating a scheme that only 1 in 8 people qualified for was never going to work. So, can the Minister tell us why, despite yesterday's announcement, it is still the case that only 1 in 8 people who test positive will actually qualify for a self-isolation payment?
Churchill.
So I thank the Honourable Member for his question. It's important that we have targeted support and that we support the people who need assistance so that they can self-isolate. It's just exactly as I outlined in my first answer what we have been doing. And as my right honourable friend, the Prime Minister, said yesterday, we'll continue to look after people through the pandemic. Our undertaking is to make sure we protect people, whether they're self-isolating or unable to work for other reasons, such as shielding, throughout the duration of the pandemic. And he will be hearing much more about that from the Chancellor next week during the budget.
Let's try Yasmin Qureshi. Yasmin.
Thank you, Mr. Speaker. My constituent, a shop worker, has a daughter who was sent home from school to isolate. She will not get paid, nor get a sick pay, and is worried about losing her job. She needs money to put food on the table for her family. Can the Minister tell the Chancellor that we can't keep infection rate down if people are not given adequate financial support?
Minister.
I thank the Right Honourable Lady for her question, and I'd also like to thank, in her particular area, 93% of contacts are being, of cases are being tracked, and people are being spoken to, which actually highlights the great work that is going on the ground locally in this area. But we are providing support, and I would really urge her constituent to reach out to the Council, because it is important that we give people the support in order that they isolate. But as I say, she will be hearing more on the subject next week from the Chancellor during the budget.
Substantive question to Minister Churchill.
Number 2, Mr. Speaker.
Thank you very much indeed. We are currently considering the best future arrangements for Public Health England's important health improvement functions. We have been engaging with key stakeholders throughout the process and will be setting out further details of our approach in due course. We are excited about creating the National Institute for Health Protection to ensure additional capacity, to ensure we have future capability, and that we have a laser-like focus on areas of health inequality.
Let's head up to the northwest with Paul Maynard. Paul Maynard.
Thank you, Mr. Speaker. I very much welcome plans to reform Public Health England's health protection functions, and note with interest the Secretary of State's new powers of direction in some public health areas such as obesity. However, Blackpool has some of the most severe public health challenges in the country. Further discussions about the health promotion functions of Public Health England were promised when the NHIP was announced. So can ministers say now how other areas of public health promotion not referred to in the white paper will be addressed?
Minister Churchill.
I thank my right honourable friend for his question, and I really recognise the challenges that Blackpool faces, and I read with interest the Blackpool Town Prospectus highlighting the public health challenges, and I am looking forward to talking to the CCG lead later this week about them. We remain convinced that place-based approaches will have the best results when we can target interventions in the right way when they are needed. I think my honourable friend is alluding to other areas such as work and housing and so on and so forth. Obviously, there are discussions going on with other departments, but those specific initiatives are for the departments themselves. And as the details of the National Institute for Health Protection is outlined, these things will become clearer. I know my honourable friend cares deeply about his constituents and their health, and I look forward to working with him and others in the future.
We now have a substantive question to Minister Doris.
On the 13th of January, we published our white paper on reforming the Mental Health Act, setting out proposals to make the Act work better for people. We have launched a 14-week consultation during which we are inviting views from the public, professionals, service users and carers to ensure we get this once-in-a-generation opportunity right.
Let's head to John Howell. John Howell.
Thank you, Mr. Speaker. I'm delighted that my right honourable friend is taking steps to bring mental health laws into the 21st century, not least because they are 40 years old. But can I take this opportunity to pay tribute to Sir Simon Wesley, who produced his independent review into the Mental Health Act in 2018? And can my right honourable friend confirm that this government will be accepting many of his recommendations?
Minister.
I wholeheartedly agree with my right honourable friend and would also like to pay tribute to Sir Simon and his co-chairs for their comprehensive work. As the Secretary of State said in the House last year, the Wesley Review is one of the finest pieces of work on the treatment of mental health that has been done anywhere in the world, and I know that the review was welcomed by honourable and right honourable members across the House. We are taking forward the vast majority of Sir Simon's 154 recommendations directly or by advancing the principles put forward by the review. The White Paper document contains the Government's response to each of the recommendations.
Shadow Minister Dr Alan Cullen.
Thank you very much, Mr. Speaker. The overhaul of the Mental Health Act has been long awaited. It is people that have to be at the heart of the legislation, and that includes staff. The promises the Secretary of State has made rely on a workforce, our fantastic frontline mental health staff, of which there are simply too few at present. I asked him last month to outline when we will get the workforce settlement and what reassurance he can give on filling the training places. We're still waiting for an answer. Would the Minister like to answer now?
Minister.
Thank you, Mr. Speaker. Work is underway on the Health Education England are looking at proposals, particularly for training mental health workers. And I'd just like to highlight one area where we can see that happening rapidly, and that is in the mental health support teams that are going into schools as people are coming out of universities with their degree, going through a year's training, so that we can get them into schools to work with young people, children and young people, quicker and faster. But she's absolutely right. Mental health workforce is at the heart of these reforms, and I can assure my right honourable friend we have seen an increase in the number of people applying to be mental health nurses, nurses across the healthcare estate, but in mental health as well, which is going to see a knock-on effect in the number of people that we have working on the wards and people with severe mental illness.
Richard Holden.
Thank you very much, Mr. Speaker. The government's vaccine programme... number 8, Mr. Speaker.
Secretary of State.
Thank you very much, Mr. Speaker. I'm delighted that on the 14th of February, We hit our target of vaccinating 15 million people across the UK, and now more than 17.7 million people, 1 in 3 of every adult in the country, have been vaccinated. The NHS is delivering more than 250 vaccinations every minute on average, and we're vaccinating at a greater weekly rate than anywhere else in Europe.
Richard Holden.
Thank you very much, Mr. Speaker. The government's vaccine programme, procurement and rollout has been described as world-beating. Not my words, Mr. Speaker, but those of the Public Accounts Committee with SNP, Labour and Lib Dem members on it. But can the Minister just clarify the link between the vaccine programme and the roadmap? Because it's the return to normality as far as possible that we want to see as soon as possible.
Well, thank you very much, Mr. Speaker. And my honourable friend is absolutely right to make this link, because the vaccines are important to keep each individual safe, and we've seen this wonderful data yesterday about how effective they are at reducing hospitalisations and deaths. But it is also the vaccination programme that is critical to the roadmap out of this pandemic. And it's only because of the success of the vaccine programme that we're able to set out the roadmap in this way. So the vaccine is good for you, but it's also good for all of us, because by taking a vaccine, you're helping protect yourself and you're helping all of us get out of this pandemic situation.
Let's head north to SNP spokesperson Dr. Whitford. Dr. Whitford.
Thank you very much, Mr. Speaker. The provision of insufficient doses for care home staff to be vaccinated at the same time as elderly residents may have contributed to only 2/3 being immunised. As well as the convenience, the solidarity of being vaccinated with colleagues has helped encourage uptake of 94% in Scotland. So will he ensure that staff can get vaccinated when second doses are delivered to care homes?
Yes, when the vaccination programme goes to a care home, they offer vaccines both to residents and to staff, of course. And we want to support the ability of more and more people to access the vaccine, and that includes care home staff. So now if you work in a care home, you can go onto the national vaccination site and book yourself an appointment. Or, of course, when we go to give the second dose to residents, then, of course, any staff who haven't yet taken up the opportunity of a vaccine will have the offer of getting going on the programme. I hope that care home staff and NHS staff across the board will listen to the words of the Chief Medical Officer, Mr. Speaker, who said it is the professional responsibility of people who work in care settings to get vaccinated. It's the right thing to do.
Shadow Minister Kendall.
Thank you very much, Mr.
Oh, sorry, you've got a second question, Dr. Whitford. Yeah.
Keeps happening to me. More vaccine-resistant strains, such as the South African variant, could risk undermining the UK's vaccine programme. As they could come via any country, does the Secretary of State not agree that all travellers should undergo strict quarantine?
Yes, I do, Mr. Speaker. All those who arrive in this country as passengers need to undergo quarantine. And we have both the hotel quarantine and the home quarantine. All need to be tested, and all those positive test results are sent for sequencing so that we can spot any new variants. This is an absolutely critical part of our national defences. And the good news is that we can see from the data that the number of new variants in the country is falling, is much lower than it was last month. And we keep that obviously under very, very close eye because making sure that we don't have a new variant that can't be beaten by the vaccine is a critical part of the roadmap as set out by the Prime Minister yesterday.
Shadow Minister Kendall.
Thank you, Mr. Speaker. The Prime Minister promised all staff in elderly care homes would be vaccinated by the end of January. Can the Secretary of State confirm that more than 30% of those staff in England have not, that this rises to almost half of all staff in elderly care homes in London? And will he urgently set out precisely how the government will increase uptake and tackle lies and misinformation about the vaccine amongst this vital group of workers, as we have been urging the Care Minister to do since before Christmas.
Yeah. Yes, we're absolutely all on the same side in this. If I just be totally clear to the Honourable Lady and all those listening, what the Prime Minister set out is that we would offer the vaccine to all residents of care homes by the end of January, and indeed offer the vaccine to all staff by the 15th of February, and we achieved that. The challenge is uptake. So rather than having a political ding-dong about it, what we all need to do is get the positive messages out about the vaccination programme. And I'm delighted that the Care Minister and the Vaccine Deployment Minister have both been working incredibly hard at this. And we published an uptake plan last weekend. So I'm sure that the Honourable Lady will want to join these efforts to try to encourage everybody to get the jab.
Substantive question to Minister Churchill.
Thank you very much indeed, Mr. Speaker. We're committed to supporting all NHS dental services through the pandemic. NHS practices receive full funding for the first 3 quarters of the year, minus agreed deductions in England, and the NHS dental contractors will continue to be supported whilst meeting reduced activity targets. NHSE and PHE continue to communicate regular updates, enabling practitioners to prioritise urgent care and reduce waiting times in what are challenging circumstances.
Up to Scotland with John McNulty. John McNulty.
Thank you, Mr. Speaker. The British Dental Association have raised concerns that punitive financial penalties for not meeting the government's unrealistic activity targets are pushing NHS dentists in England to prioritise quick checkups rather than catching up on the backlog of more time-consuming symptomatic cases. Therefore, will the Minister consider a more realistic approach to service recovery and commit to reforming the dental contract in England so as to promote preventative dental care in the future?
I thank the honourable gentleman for his question. As anybody will know, I have been heavily engaged with the dental profession over recent months because I agree a preventative approach to dentistry is certainly one that we need to be moving towards. The activity target is expected to increase availability for patients, who are the important part of the equation. So it is important we support the profession but enable patients to have access, reducing waiting times for backlogs. It's based on careful modelling on data and takes into account guidance on infection prevention and control and social distancing measures. We recognise there may be exceptional circumstances, and that is why there are exceptions to the target level. NHS commissioners have the discretion to deal with exceptions and support dental practices. I am meeting with everyone again on Thursday.
Substantive question to Minister Hancock.
Thank you, Mr. Speaker. Alongside our investment in 40 new hospitals, more broadly, our health infrastructure plan will deliver a long-term rolling programme of investment in health infrastructure, including our vitally important district hospitals. And I know his constituents are well served by the Hospital of St Cross. Hospitals have benefited from over £600 million of critical infrastructure risk funding, including district hospitals, and will shortly be receiving their capital allocations for the forthcoming financial year.
Let's head up to Mark Palsey. Mark Palsey.
Thank you, Mr. Speaker, and I'm grateful to the Minister, and he's right that it's entirely the right thing to be investing in the new hospitals, the 40 new hospitals for our NHS. But he referred to our brilliant local district hospital, St Cross, and the current year, the last year, has reminded us of the importance of well-resourced local health services. So my question to the Minister, how can we ensure that existing district hospitals doing great work, such as St Cross, continue to receive the investment they need?
Thank you, Mr. Speaker. I'm grateful to my honourable friend, and can I suspect, join with him in paying tribute to his local hospital of St Cross and the team who have done an amazing job in very challenging circumstances over the past year. I know he's a strong champion of it and his local NHS, and I think, if I recall, volunteering himself at the Lockhouse Vaccine Centre recently in support of his NHS. Of that critical infrastructure funding I referred to, £2.2 million was allocated to his trust and local hospital. And as I mentioned in my initial answer, we will be making further capital allocations shortly, which will benefit district hospitals, including his own.
Number 13.
Thank you very much indeed, Mr. Speaker. This government is working hard to set up patient-focused, evidence-based and effective support for people with long COVID. In October, NHS England and Improvement announced a 5-part package of measures, including the establishment of 69 multidisciplinary assessment services. Last week, almost 20 million of research funding was committed to help identify the causes of long COVID and identify effective therapies to treat people who suffer from some of the chronic symptoms.
Thank you, Mr. Speaker. My constituent, Emma Sams, the actress, has pulled together a reunion of the cast of Dynasty to add some glamour to fundraise for research into long COVID. And in Gloucestershire, we are also setting up a clinic. We clearly need to learn an awful lot more about the symptoms. Will my right honourable friend join me in praising these initiatives and continue to reassure that we will have full support to the GPs and hospitals and patients for this awful disease?
I thank my my honourable friend, and I'm delighted to join her in congratulating Emma, who I know is using her experience of having had COVID for such an innovative fundraising idea. I've already got a Dallas-style hairdo because I haven't been for some months. I'm just going to get some shoulder pads. I would like to thank her and all volunteers and fundraisers who are doing a marvellous job and coming up with some really great ideas to support research.
We now come to a substantive question from Minister Wexler.
With your permission, Mr. Speaker, I will answer questions 14 and 15 together. Throughout the pandemic, we've had to strike a balance between protecting people from this cruel virus and social contact. Nowhere has this been harder to do than in care homes. That's why I'm so pleased that from the 8th of March we will be enabling care homes to open up carefully to more visiting. Our guidance will set out how residents can have a named person for repeat visits with testing and PPE so those visits can be indoors. And we look forward to enabling more visiting as soon as it is safe to do so.
I said no to Emma Hardy. Emma.
Thank you, Mr. Speaker. And I welcome the new guidance on care home visits, but I'm particularly concerned with the phrase that was used, with the agreement of the care home, because does the Minister share my concerns that this may allow some care homes to disagree with the guidance and therefore decide the risk is too high and prevent the physical contact that residents in care homes are so desperate to have with their loved ones?
Well, the Honourable Member makes an important point. We are clear and have been clear that we want to see care homes enabling visiting. We recognise that care homes are, of course, having to balance giving residents access to visitors while also making sure those residents are safe. And our guidance will provide further support to care homes on how they can make sure those visits happen.
Thank you, Mr. Speaker. Care homes to older folk and disabled people are a basic human right, and yet due to the fact perhaps that a third of all deaths from COVID have been care homes or care home residents, perhaps in hospital but in care homes. Therefore, shouldn't the government be trying just a bit harder to provide the staffing which is often required for those extra visits? And when is the government going to lay out its plan to address social care, which is so clearly lacking and has been promised for about 10 years now?
Well, the Honourable Member is right to say that visiting at the moment does involve extra staffing, for instance, staff to supervise visits and also to support the testing, which we will be bringing in with the new visiting guidance. We have already provided funding to the social care sector, which can be used to support the cost of visiting, and also additional funding for extra workforce costs.
We now have a substantive question to Minister Zahawi.
Thank you very much, Mr. Speaker. With your permission, I will answer questions 17 and 18 together. The government has secured early access to 457 million vaccine doses through agreements with 8 separate vaccine developers, and I want to just assure the House that the Government is in constant contact with the vaccine manufacturers and remain confident that we are on track to offer a vaccine to all priority cohorts by mid-April.
Let's head up to the Midlands with Mike Wood. Mike Wood.
Thank you, Mr. Speaker. People like my constituent Ken in Dudley South have seen the European Commission threatening to ban vaccine exports to the UK, and they're worried about whether they'll be able to get their second dose. What assurances can my honourable friend give to Ken and others like him that they will be able to get a second dose of the same vaccine within the specified time schedule?
Thank you, Mr. Speaker. The Vaccines Task Force, and I want to pay tribute to Kate Bingham and Clive Dix, but also to the brilliant civil servants that do the heavy lifting, has conducted a supply chain risk assessment and continues to monitor the requirements across the supply chain from supplier through to patient. We are in constant contact, as I said, with the suppliers. The NHS is already reserving second doses, and actually last week we began informing the front line, the primary care networks and others, of the second dose schedule. I can reassure his constituents, if they've had a Pfizer first dose, they will get a Pfizer second dose within 12 weeks. If they've had an Oxford first dose, they will get an Oxford second dose within the 12 weeks.
We're heading to Dr. Jamie Wallace. Dr. Jamie Wallace.
Thank you, Mr. Speaker. Will my honourable friend confirm that Wales has been provided with enough supplies of vaccines to hit the same targets the UK government set, specifically the July 31st target? And does he agree with me that had we joined the EU's vaccine programme, procurement programme, then immunisations in Wales would be much further behind right now?
I'm grateful for my honourable friend, and we are working very closely with the Welsh Government and other devolved administrations to ensure vaccines are allocated as per the Barnett formula, and as the Secretary of State quite rightly has reassured all devolved administrations that they will receive the vaccines to be able to deliver on targets that we have set. It's great to see over 860,000 people have received their first dose in Wales. The pace of our vaccination programme, Mr. Speaker, means we have administered more vaccines than any other European country.
Right, we have a substantive question to Minister Waitley.
Thank you, Mr. Speaker. During the pandemic, the government has provided over 1.1 billion for infection control, 149 million for rapid testing costs, and 120 million to boost the workforce in adult social care, and that's in addition to 4.6 billion to local authorities. For 2021-22, we are meeting our commitment to an annual uplift of 1 billion for social care and will provide councils with access to an additional £1 billion.
Let's head up to Yorkshire with Kevin Holdinray. Kevin.
Thank you, Mr. Speaker. Does my honourable friend agree that the best long-term funding solution for adult social care is a German-style social care premium?
Minister.
Thank you, Mr. Speaker. I agree we need a sustainably funded social care system, and I know my honourable friend is very well informed on the options for this. We are committed to taking forward social care reform, and we will be publishing proposals later this year.
We now have a substantive question to Minister Harker.
Thank you, Mr. Speaker. £600 million has been allocated to tackle almost 1,800 urgent maintenance projects across 178 trusts, all due for completion by March 2021. £450 million has been invested to upgrade A&E facilities, with funding awarded to over 120 trusts and improving over 190 urgent treatment sites this winter. And of course, in addition, the Prime Minister has also confirmed 40 new hospitals will be built by 2030, with an additional 8 further schemes to be identified. 6 of these are already under construction. With your permission, sir, may I group it with question 21?
Let's head up to the Potteries to John Gideon. John Gideon.
Thank you, Mr. Speaker. NHS staff at the Royal Stoke University Hospital in my constituency have been using the old Stoke Royal Infirmary site, which stopped delivering clinical services in 2012, as car parking. However, with the demolition of buildings on this site, in readiness for the creation of many new houses, hospital staff are in real need for the University Hospitals of the North Midlands NHS Trust's proposed plans for a multi-storey car park to come to fruition. Will the Minister ensure that the necessary investment is forthcoming for additional staff car parking facilities at the Royal Stoke University Hospital to support our wonderful NHS staff and unlock this vital regeneration project for the people of Stoke-on-Trent?
Thank you, Mr. Speaker. I'm very grateful to my honourable friend, who is a strong champion and a strong voice for Stoke and for her local hospital. The Government are committed to increasing hospital car parking capacity and supporting trusts to invest in their car parks. We will continue working with NHS England and Improvement as well as trusts, such as her own, to understand the specific requirements. I understand that an emergency funding application by the Royal Stoke in this respect has been received and is currently being considered. However, I'm always happy to discuss with my honourable friend the specifics of the case she raises.
We now come to Andrew Jones.
Thank you, Mr. Speaker. Harrogate District Hospital, which is an excellent hospital, will be reducing its carbon footprint by a quarter and making energy cost savings thanks to a £14 million government grant. But the healthcare estate is much more than hospitals, it's doctors, surgeries, specialised clinics, etc. So what steps is my honourable friend taking to ensure the whole estate, whether it's large or small, is included in the investment and decarbonisation programme?
Minister.
Thank you, Mr. Speaker, and how could I have failed to remember to group my honourable friend's question, for which I apologise to him. He's right to pay tribute to his local hospital in Harrogate. Zero carbon and environmental sustainability is a key design criteria in our 40 hospitals programme, but it's also right my honourable friend refers to the need for that to flow throughout the NHS estate. The NHS's Net Zero report provides a detailed plan for decarbonising that whole NHS estate and services, and in that context, for example, there is already a range of action underway, including the £50 million NHS Energy Efficiency Fund, which, as a small example, is upgrading lighting across all NHS buildings, big and small, to improve environmental sustainability.
Substantive question to Minister Wetley.
Thank you, Mr. Speaker. Our health and social care workers have been simply extraordinary during the pandemic, caring for people in the most challenging circumstances. We have done our utmost to support them every step of the way, and we will continue to do so. We are recruiting extra staff. We're on track to have 50,000 more nurses in the NHS, funding things that help when you're working long hours, funding social care providers to pay full pay for staff who are isolating, and we've put in place a package of mental health support for health and social care staff.
Let's send to Cole McCartney. Cole McCartney.
Thank you, Speaker, and thank you to the Minister for that fulsome answer. Ensuring that we take care of our NHS is critical, as I know here in Lincoln. Therefore, we must be at the forefront of fighting all aspects of this disease. At what stage did the Secretary of State and his officials become aware that vitamin D helped fight COVID symptoms for certain sections of our society? How long was this information suppressed or ignored? And what steps have subsequently been taken to take appropriate action? And what other drugs have also not been fully utilised so far, such as hydroxychloroquine?
Thank you, Mr. Speaker, and I thank my honourable friend for his question. I can tell him that NICE published a guideline on vitamin D for COVID in December. Now, their expert panel supported current government advice to take vitamin D supplements through the autumn and winter, but there is insufficient evidence to say that taking vitamin D mitigates effects of COVID-19. And also I can say that hydroxychloroquine is not recommended or authorised for the treatment of COVID outside trials.
Thank you, Mr. Speaker. Question number 23.
Thank you very much indeed. I'd like to group this with question number 24. The tremendous efforts of our NHS cancer workforce are helping to ensure that those who need treatment can continue to access it without delay. The NHS, as have ministers, been clear since the beginning of the pandemic, the continuation of urgent cancer care must be a priority. The NHS has established COVID-secure cancer hubs, consolidated surgery, centralised triage to prioritise patient based on clinical need, and utilised the independent sector for capacity.
Thank you, Mr. Speaker. Staff at North Middlesex Hospital have done an incredible job under difficult circumstances delivering cancer care and treatment. But despite this, the government acknowledged there are over 30,000 people who are missing a diagnosis of cancer compared to 2019. With the Cancer Recovery Plan due to expire at the end of March, can the Minister please set out her commitments to beating the backlog after March, and how a renewed Cancer Recovery Plan will help meet the ambitions for cancer care set out in the NHS long-term plan?
Of course. I, like him, are concerned about those that haven't come forward and those that are not currently accessing treatment. I would like to reassure him that once people do come forward, there is a speedy path to treatment. The numbers of those who are entering treatment both on 2-week and on 31 days is ahead of what it was at this time last year, and we are seeing just enormous efforts from the cancer workforce. I am meeting with, actually this afternoon, with the APPGs for radiotherapy and cancers, and we will be discussing the recovery plan, which, he is right, goes to March. However, every single trust has been targeted with producing a plan for their ongoing assessment of how they are addressing the backlog going forward.
Said to the North West with Mick Whitley. Mick Whitley.
Thank you, Mr. Speaker. Macmillan Cancer Support estimate that there are over 40,000 people missing a cancer diagnosis across England, including around 60 people in my constituency of Birkenhead. Behind each statistic is a family member and loved one whose prognosis and survival chances are being severely affected by the disruption caused by the pandemic. Could the Minister tell me what additional funding would be made available to ensure that missed cancer diagnosis are caught as soon as possible? Thank you.
So I thank the honourable gentleman for his question. The latest official data for December, as I say, suggests that urgent 2-week wait for GP urgent referrals are 7% higher than the same month last year. 62-day GP urgent referrals was 6.7% higher, and urgent referrals for cancer were 151% higher than in April, showing the month we were most impacted. As I say, we are straining every sinew to make sure that cancer services not only recover, but go on and are better to deliver more care for patients.
Alex Norris.
Thank you, Mr. Speaker. Going into this pandemic, staff shortages were already causing increased waiting times for cancer treatment. But despite being short-handed, our wonderful NHS cancer staff have done a heroic job maintaining services whilst fighting this virus. But given the size of the backlog, cancer services will need to go above and beyond pre-pandemic levels for a significant period of time, straining every sinew, as the Minister says. They need extra resources to be able to do so. Next week's budget must contain these resources. Has the Minister asked for them?
So cancer has been prioritised with funding throughout the pandemic. It is, as I say, a key priority. We have seen that we have invested not only in radiotherapy equipment to the tune of some 325 million, 160 million initiative to provide COVID-friendly cancer treatments, which are safer for people. We still have the objective the same objective in the long-term plan to diagnose more cancers early, and appropriate funding, such as the £1 billion that was targeted at the NHS in order to drive down cancer backlogs and to ensure people can access care, is part of that strategy.
Extensive question to Minister Zahama.
Thank you very much, Mr. Speaker. Overall, Mr. Speaker, we are encouraged by the vaccine uptake in the most vulnerable groups, with almost over 17.7 million people in the UK having now received their first vaccination. To date, black people, who account for around 3% of the population, make up 1.7% of those vaccinated, whilst white people, who account for 86% of the population, make up 82% of all those vaccinated in England. We appreciate there is still work to do, and our vaccine uptake plan addresses that.
Over to Diana. Can the
Secretary of State speak to Public Health England and ensure that local directors of public health make this information and other information in relation to specific cohorts, make it available on a borough level to local MPs? He will be aware that the danger is we could be hitting our vaccination targets overall, but certain groups are left behind. And many local MPs want to have some transparency about what is happening locally.
I'm grateful for the Honourable Lady's question. She and I visited the Hatzola first responders who did an incredible job that Saturday night of vaccinating 364 people, not only from the Haredi Hasidic Jewish community, but from the Muslim community as well. Our uptake plan has 4 key enablers, Mr. Speaker. Working in partnership with local government, with Directors of Public Health, removing barriers to access, i.e. access being available at a time and place when people need it, data and information, which she refers to, which we absolutely share with Directors of Public Health, and we want to share it in more granular ways, and of course, engagement.
We now have a substantive question to Minister Waitley.
Thank you, Mr. Speaker. The NHS is working to improve care for patients with all types of liver disease. Development and improvement of clinical care is supported by NHS England's Hepatobiliary Clinical Reference Group. This clinical reference group has started work on the development of liver networks in England to enable quicker access to specialised liver services, as well as providing clinical advice on disease prevention and referral practice.
Let's go to Tracy Crouch. Tracy.
Thank you, Mr. Speaker. Liver disease has become one of the major causes of premature mortality in the UK, and COVID has highlighted the susceptibility of people with liver disease to develop more serious cases of the virus. With that in mind, what plans does the Minister have to include improvements to liver care as part of the NHS recovery plan?
Thank you, Mr. Speaker. Last autumn's spending review included £1 billion of funding to address backlogs, tackle long waiting lists and support up to 1 million extra checks, scans and additional operations in the NHS. As the NHS recovers, for liver care, as for other areas of treatment, we will look to not only recover backlogs, but also continue to improve the care provided and help people to live healthier lives to prevent illness in the first place.
Now come to topicals. I call Secretary Matt Hancock to make a statement on the responsibilities. Then I will call Liz Twist to ask her supplementary. Secretary.
Mr. Speaker, yesterday the government published the roadmap that will put us cautiously, but we hope irreversibly, on the path towards reclaiming our freedoms once more. We're able to take these steps because of the resolve of people across the UK and the extraordinary success in vaccinating over 17.7 million people. That's 1 in every 3 adults across the UK. And I'd like to pay tribute to everyone who has played their part.
Let's head to the North East with Liz Twist. Liz.
Thank you, Mr. Speaker. This coming Sunday is Rare Disease Day 2021. 1 in 17 people in the UK will be affected by a rare disease, and today people with PKU are awaiting the outcome of a NICE appraisal of Kuvan. But 12 years waiting for Kuvan or other treatments is too long. Does the Secretary of State agree with me that our rare disease community deserve access to early diagnosis and treatment? And what will he do to make sure this happens?
Mr. Speaker, the Honourable Lady has been a long-standing and passionate campaigner for Kuvan, and I pay tribute to the work that she has done. The NICE Methods Review looks at the question that she raises. It is important that we have a process, a clinically led process, in terms of approval of medicines, and I know that she agrees with that. The question is ensuring that the details live up to that principle. And the methods review will make sure that we take advantage of advances in medical technology, which will, I hope, allow us to bring drugs and treatments to patients of rare diseases who need them more quickly than in the past.
Let's head over to the Chair of the Select Committee, Jeremy Hunt. Jeremy.
Thank you, Mr. Speaker. And can I add my support to the previous question about the urgent need to sort out the issue of Kuvan, because I too have constituents suffering very, very badly from the long wait that they've had. But I wanted to talk to him about support for NHS frontline staff who have done such a magnificent job this year, but worry that even now we are not training enough doctors and nurses for the long-term needs of the NHS, and that is the crucial way that we will reduce the pressure on them. So could I ask him, will he be publishing a workforce plan this year? Will that have independent projections as to the number of doctors and nurses the NHS will need in every specialty over the next couple of decades? And will he commit to funding the number of training places that we need to make sure that we meet those needs of the future?
The good news is, Mr. Speaker, that thanks in part to the work that my right honourable friend did when he was in my shoes, we now have a record number of doctors in the NHS, and he will have been as pleased as I was to see the record number of applicants to nursing places as well, because we need both more doctors and more nurses. I'm delighted that during the pandemic, we have increased numbers very substantially. And in terms of nurses, we are on track to meet our manifesto commitment to 50,000 more nurses. And we've seen a significant increase, just under 10,000, in the number of doctors too. So there is significant progress. Of course, there's more to be done. And of course, we'll need to set out the route to that, as he suggests. The time is not quite right now, because right now there are still very urgent needs and pressures thanks to the pandemic. I'm sure that he and the Select Committee understand that, but this is undoubtedly a question that we'll return to.
Shadow Secretary Ashworth.
Thank you, Mr. Speaker. So everybody knows, apart from him it seems from this morning's media, that there were PPE shortages. The National Audit Office reported on it. We saw nurses resorting to bin bags and curtains for makeshift PPE. Hundreds of NHS staff died. And his response was to pay a pest control firm £59 million for 25 million masks that couldn't be used, to pay a hedge fund based in Mauritius $252 million, again for face masks that were inadequate, and to pay a jeweller in Florida $70 million for gowns that couldn't be used. So will he take this opportunity to apologise, and will he commit to recovering every penny piece of taxpayers' money from those companies who provided us with Duff PPE?
Mr. Speaker, well, I'm going to start by congratulating the honourable gentleman, the right honourable gentleman, for his appointment to the Privy Council. I appreciate the work that he's done in support of the government, in support of the nation during this pandemic. And though occasionally he turns to rhetoric and narrow questions that he knows there are perfectly adequate answers to, he has generally, during this pandemic, Mr. Speaker, in the face of temptation, actually, and I mean this very genuinely, he has done the right thing and supported the right messages to people where they need to be made across party lines. And so I congratulate him. And I thank him for that. On the specifics of the question he raised, of course, where a contract isn't delivered against, we do not intend to pay taxpayers' money. But of course, also, we wanted to make sure that we got as much PPE as we could into the country. And whilst, of course, there were individual instances that we all know about and that highlight how important it was to buy PPE, there was, as the National Audit Office has confirmed, no national level shortage, and that was because of the incredible work of my team and the amount of effort they put into securing the PPE and doing the right thing.
Well, I dare say the Secretary of State has just finished off my political career with that fulsome praise, Mr. Speaker. But on the substance of the point, I think he confirmed that he will... when did it start? When did it... I think he was saying that he will not be trying to recover money that he's paid out for Duff PPE in that answer. But can I ask him about a different issue, which again comes down to public scrutiny and accountability? In London a week ago, or a week and a half ago, GP services for 375,000 patients were taken over by the US Health Insurance Corporation, Centene. There was no patient consultation. There was no public scrutiny. This is arguably a stealth privatisation with huge implications for patient care. Will he step in, halt the transfer, ensure it's fully scrutinised and prevent takeovers like this happening in the future?
Well, Mr. Speaker, on his first point, such a reasonable and sensible man is, of course, always welcome on these benches. And I might point out, Mr. Speaker, that since his wife is taking the Labour Party to court, why doesn't the whole Ashworth family come and join us on this side? On the substantive point that he raises, of course, what matters for patients is the quality of patient care. And we've seen again and again, including especially throughout the pandemic, that what matters to people is the quality of care. And that's what we should look out for. And that is, I know, what what doctors, nurses and other staff, both in primary care and right across the board, are working so hard to deliver.
Speaker, my right honourable friend will be aware that the Airedale Hospital in my constituency is now over 50 years old, and 83% of the building is constructed from aerated concrete, which is known for its structural deficiencies. It's great news that this Conservative government will commit to funding 8 new hospitals in addition to the 40, but can I make an urgent plea to my right honourable friend that the Airedale Hospital, given its high risk profile, is considered as one of the final 8?
Mr. Speaker, I think my honourable friend has just made his heartfelt plea, and it certainly landed with me, but I'm not surprised because he's made this case to me on behalf of his constituents over and over again. He's quite right to. We are in the process of considering which hospitals will be in the 8 additional, on top of the 40 that we committed to in our manifesto. I'm grateful for his representations, and we will certainly consider Airedale in its full needs of the local community.
I said to Wales with Chris Blank. Chris.
I wonder whether the Health Secretary would agree with me that coronavirus has not only changed many of the ways that we have to do our lives, but it is fundamentally going to have to change the whole structure of the NHS for the future. So that means we're going to have to recruit more pathologists in this country for ourselves. We're going to have far more ICU capacity for the future. We're going to have UK manufacture, not only of PPE, but also of vaccines, if we're to be able to be self-reliant. We're going to have much better long-term rehabilitation for people with brain injuries. And we're going to have a complete review of our care homes, aren't we?
Thank you very much. There will be many, many lessons that we need to draw from the pandemic. And for instance, my brilliant team who've done all this procurement of PPE have also built an onshore PPE manufacturing capability, because for almost all items of PPE, 70% of it is now made onshore in the UK, up from about 2% before the pandemic. Likewise, for vaccines, where we didn't have large-scale vaccine manufacture, and we now do, and a whole host of other areas, including some of those that he mentions.
Let's head to Joy Morrissey. Joy.
Thank you, Mr. Speaker. With regard to the recent court ruling on the issuing of PPE contracts, will my right honourable friend confirm that as a result of the action taken by health department officials, NHS trusts did receive vital PPE despite there being a global shortage?
Right, my honourable friend is absolutely right. And the court ruling in question found that whilst we were on average 17 days late with the paperwork, that court ruling did not find against any of the individual contracts. And my team worked so hard to deliver the PPE that was needed. And so, as the National Audit Office has confirmed, and as my honourable friend set out, there was never a point at which there was a national shortage. There were, of course, localised challenges, and we were in the situation of a global demand, huge increase in demand. But I think that we should all thank the civil servants who did such a good job.
Right, let's head to Daisy Cooper. Daisy Cooper.
Thank you, Mr. Speaker. The Prime Minister's first test for easing restrictions is that the vaccine deployment continues successfully. Yet GPs and pharmacists have been telling me for weeks and weeks and weeks in St Albans that they cannot get the vaccine supply that they desperately need. They could be vaccinating 14,000 people a week, but they're only getting the supply for 1,000. Why is that, and when will it be fixed?
Thank you very much, Mr. Speaker. As we have repeatedly explained, supply is the rate-limiting factor, and she will no doubt have seen that there have been some international discussions on the rate of supply, and countries around the world are finding supply being the rate-limiting factor. But thankfully, we have, thanks to the decisions taken early by this government, we have one of the best access to the supply of vaccine in the world, and that's why we have one of the best vaccine delivery programmes in the world.
Chris Grayling. Chris.
Thank you, Mr. Speaker. Can I congratulate my right honourable friend again on the progress of the vaccination process? He should be proud of what he's achieved. But, Mr. Speaker, the documents published yesterday about the roadmap didn't appear to contain any assessment of the infection risk in individual settings which could have demonstrated that there were carefully informed decisions about the reason for each individual restriction. Could the Secretary of State tell me if this work has actually been carried out? And if it has, will he commit to publishing those assessments immediately?
Well, of course we assess this, but it is challenging to get to a statistical answer to the question that he raises, because when we have taken action to restrict access to areas where there's evidence of significant transmission, like the hospitality industry, that of course then confounds the statistical analysis because people can't then go there, and therefore, of course, the passing on of infections in that environment reduces. So this is a matter of evidence and of judgment, and it is a significant challenge. But the roadmap is based on our best assessment of the situation, based on that clinical advice, including, of course, the focus on the fact that we do know that outdoor is safer than indoor, and hence the early steps after schools are focused on opening things up outdoors.
Let's head to Glasgow with Carol Monaghan. Carol Monaghan.
Thank you, Mr. Speaker. Opening up by dates, not data, as described by the Prime Minister yesterday, will allow prevalence in the general population to continue, unfortunately increasing the number of people affected by long COVID. So what discussions has the Secretary of State had with the Secretary for Work and Pensions to ensure proper financial support is available for those afflicted by long COVID, including a continued £20 a week uplift of universal credit?
Secretary Hancock.
Thank you very much, Mr. Speaker. Of course, long COVID is an incredibly serious condition for some and is part of our considerations and deliberations. But I just want to correct her on something that she said, because the roadmap sets out indicative dates that we will not move before, but of course will be guided by the data, and hence the 5-week gaps in between each step to make sure you have 4 weeks to see the impact of the step and then 1 week of advance notice on the go, no-go decision. That's based on clinical advice, and I know that that clinical advice is shared across the UK.
Let's head to Duncan Baker. Duncan Baker.
Thank you, Mr. Speaker. I am delighted that many carers are in Priority Group 6, given the enormous and vital role they are playing during the pandemic. Recently, I led an initiative to help my local county council identify carers and unpaid carers around Norfolk, as many are not on official registers. Could my right honourable friend tell me how he's working with Norfolk County Council and all local authorities to ensure those difficult to find carers are not missed in the call to be vaccinated?
Tribute to my honourable friend's work here in making sure that all carers who are properly in Priority Group 6 get the opportunity to be vaccinated, including those who may be unregistered with the system but nevertheless are carers. It's very, very important. I pay tribute to the work of Norfolk County Council. I know that my honourable friend, the Care Minister, would be very happy to meet him and the County Council to discuss what further could be done.
Let's head as our final question to Dr. Ruperhel. Sorry about this, but we've taken a long time getting to this stage. Dr. Ruperhel.
Thank you, Mr. Speaker. It's pleasing that anti-vax propagandising's been clamped down on, but long predating COVID, on a daily basis, women seeking to access abortion clinics have faced anti-choices. At the moment, they're on a 40-day running Lent protest. So can he work with ministers across government to ensure that no woman ever feels harassed or intimidated obtaining medical care that she is legally entitled to?
I'm very happy to take up that proposal. Of course, nobody should be harassed in any access to any medical treatment. There are agreed rules around abortion, and people should be able to access abortion properly according to those rules.
So, sorry about that. We now suspend the House for 3 minutes to enable necessary arrangements for the next business to be made. Order.